For yet another respiratory lecture. Second to last one, hopefully. That's my goal. Let's not waste any time. Let's get going. Another thing that affects the exchange of gases in the lungs is the thickness of this membrane here. This is the respiratory membrane. This is what oxygen and CO2 have to cross. Oxygen, of course, going from where it has a high PO2 in the alveolar air space to where there is a low PO2 in the blood. CO2 going from where there is a higher partial pressure here in the blood to where it's lower in the airspace. And in order for those gases to do that, they've got to go across this respiratory membrane, which consists of the type 1 alveolar cell plasma membrane plus the the pulmonary capillary epithelium. So the combination of these two epithelial cells, both simple squamous, plus a little bit of connective tissue in between. Anything that thickens this, whether it be scar tissue, whether it be it's the buildup of fluid in someone with pneumonia, is going to impair respiration. All right, another topic we got to work on is Dalton's law of partial pressures. Okay, when we're talking ventilation, we're talking about the movement of gas down a pressure gradient. We talk about atmospheric pressure versus lung pressure. We do not talk at that point about the pressure of individual gases. We could, but it's not necessary yet. However, when we get into the lungs, into the blood, we got to talk about individual gas pressures. We're able to because of this thing called Dalton's law of partial pressures. If you have a mixture of gases, that mixture will have a certain total pressure. The pressure of that mix will be a sum of the pressures of the individual gases. And these individual pressures are known as partial pressures. So we're going to use the words partial pressure of oxygen to talk about the individual pressure due to oxygen, partial pressure of CO2 to talk about that pressure due to CO2. Okay? Good. Great. Let's do it. Let's look at some numbers. Here we've got our alveolar airspace. In the alveolar airspace, note that the PO2, the partial pressure of oxygen, is 104 millimeters of mercury. The blood coming into the pulmonary capillary has a PO2 of 40 millimeters of mercury. So oxygen is going to go from where there is a higher PO2 to where there is a lower PO2. Meanwhile, CO2 is going to do the opposite. The blood coming in has a PCO2 of 45, whereas the alveolar air has a PCO2 of 40. So CO2 moves that way. All right, you may wonder, well, shoot, 104 to 40 is a difference of 64. 45 to 40 is a difference of only 5. Why is there such a bigger gradient for oxygen compared to that of CO2? The reason boils down to solubility. Oxygen is far less soluble in water, thus in blood, than CO2 is. So basically the way to think about it is because oxygen doesn't dissolve as well, it needs a bigger push to get into, or out of for that matter, solution. Okay, if we then jump to the tissues, in our tissues, the PO2 is low because of mitochondrial respiration, using up that oxygen. PO2 in your cells is about 40. PO2 of blood coming into the capillary here, the systemic capillary now, is about 95. 95 beats 40, so oxygen goes in. Meanwhile, inside the mitochondria, we are making CO2, so our pressure there is about 45, and in the blood, it's about 40, so CO2 diffuses the other way. This is our systemic gas exchange. And in order to be precise in these gas exchanges, both systemic and alveolar, we got to talk about our partial pressures of oxygen and CO2. Okay, now let's move on to oxygen transport. We just mentioned that oxygen is not that soluble, so it's no surprise that 98.5% of it is bound to hemoglobin. Of course, hemoglobin molecules are stuffed inside red blood cells. And of course, the other 1.5% of the oxygen floating, dissolved in the plasma. Now, hemoglobin with oxygen is known as oxyhemoglobin. Without oxygen is reduced hemoglobin. You may also call it deoxyhemoglobin. And remember, of course, that every hemoglobin molecule has 1, 2, 3, 4 hemes, thus 4 irons. Thus, every hemoglobin can bind 4 molecules of oxygen. Here is a chemical equation representing that binding. Here we have deoxyhemoglobin, HHB, plus oxygen yields oxyhemoglobin plus a hydrogen ion. Note this is a reversible reaction. We want hemoglobin to pick up oxygen and let it go. It's going to pick it up in the lungs where oxygen is abundant. So in the lungs, the graph will run from the left side here to the right as we pick up oxygen to make oxyhemoglobin. In the tissues, it's going to run to the left as oxyhemoglobin releases the oxygen so that cells are able to utilize it. Interestingly, CO2, heat, lactic acid as well, all push this reaction to the left. This makes total sense because when are we going to get CO2, heat, and acid? In working tissues. Imagine a working muscle tissue. That working muscle tissue is going to demand oxygen. So if its products accelerate the release of oxygen from hemoglobin, that would benefit the muscle cells. Okay. Got to talk about hemoglobin saturation. If every hemoglobin has 4 oxygens on it, then hemoglobin is 100% saturated. Similarly, if there's an average of 3 per hemoglobin, 75% saturated. Average 2, 50, 1, 25, 0, you're probably dead. In our lungs, in our pulmonary capillaries, hemoglobin is going to be 100% saturated. Similarly, there we go. Similarly, in our arteries, systemic arteries that is, hemoglobin is going to be about 100% saturated. Here's where it gets a little interesting. In the systemic veins. Now realize systemic veins are after capillaries, so the hemoglobin should have released some oxygen. Question is, how much? Well, the systemic veins are going to be 75% saturated in hemoglobin. This means there's still 3 out of 4 spots filled with oxygen on each hemoglobin. Only 1 oxygen was released in the systemic capillaries. Well, why does this make sense? Well, here's the reason. I bet you're sitting down right now. You don't want to release all your oxygen when you're sitting down. If you all of a sudden were in a fight or flight situation, you would want to have that extra oxygen, be able to utilize it. That fact that you don't release all your oxygen on your hemoglobin with each pass through a capillary is known as your venous reserve. All right, bad news. Don't worry about this graph. Good news. Let's keep going. Let's begin the topic of CO2 transport. CO2 transport. Remember, CO2 is more soluble than oxygen. So 10% of your CO2 is dissolved in the blood, in the plasma. Another 20% is bound to hemoglobin and is known as carbaminohemoglobin. Now realize the CO2 is bound in a different place than oxygen binds. Last but not least, certainly not least, last but most, 70% of your CO2 is found within the bicarbonate ion, HCO3-, which is floating in plasma. All right, here we have a picture of what's going on in your blood. CO2 is making tissue cells are making CO2. There we go. CO2 diffuses into the interstitial fluid, then into the bloodstream. And inside the bloodstream, 4 different things are going to happen to it. And we'll pick up with those 4 things next time.